The Hilda and J. Lester Gabrielov Division of Endocrinology, Diabetes, and Bone Disease at the Icahn School of Medicine is a very large division of endocrinology that spans services across our entire health system, which reaches not only Manhattan, but out into the boroughs. And we deliver excellent diabetes care as well as general endocrine care, both primary and then referral, very highly specialized care.
We have a very strong commitment to research in diabetes and metabolism for several reasons. One, diabetes is one of the most common of all medical diseases. About 30% of patients that are admitted to Mount Sinai Hospital have diabetes. And the consequences of long-term diabetes is very significant. It can affect one's life throughout their lifespan. And so we feel it's our responsibility to do research and to come up with better treatments like obesity.
Diabetes and obesity have been associated with a number of different cancers. They're both associated with an increased risk of developing certain cancers as well as an increased mortality from certain cancers. And the metabolic syndrome, which is a spectrum, part of the obesity and type 2 diabetes spectrum, is associated with obesity, dyslipidemia, and insulin resistance, and we think that a lot of these factors contribute to the increase in cancer growth and mortality.
The link between diabetes and Polycystic Ovary Syndrome, or PCOS, was first recognized as a phenomenon, and then through research, a lot of which I led in my research group, we came to realize that these women are profoundly insulin resistant and at very increased risk for developing type 2 diabetes at a young age. We're talking about women who are adolescents and young adults. So it's a significant risk factor, and we now recognize that for type 2 diabetes.
Pancreatic beta cells are the cells in the body that make insulin. They're located in the pancreas. We all have a total of about a cc, this much in terms of total beta cells, and their job is to make insulin. It turns out that everybody with diabetes has inadequate numbers of beta cells. That's true for both type 1 diabetes and type 2 diabetes. And so an obvious solution to that would be to figure out ways to replace or regenerate beta cells. In type 1 diabetes, pancreatic beta cells are destroyed by the immune system. Nobody really knows why it is, why that happens. It's called autoimmunity. And type 1 diabetes accounts for about 5% of people with diabetes.
The focus of our research here at Mount Sinai in type 1 diabetes relates to closed-loop systems or artificial pancreas. As we continued to provide care to patients, it became very obvious over the last 5 to 8 years that the direction that is critical in terms of providing care to patients with diabetes is to provide benefits from a device and technology perspective. And this is what's led us to the direction to collaborate with multiple different institutions throughout the country, as well as the pharmaceutical industry in artificial pancreas development.
Going forward, there's a lot more that needs to be done. As I mentioned, autoimmunity is a big challenge. Mount Sinai is extremely strong in autoimmunity and immunology, and we're working closely with the Immunology Institute to develop ways to bypass or overcome or prevent the autoimmunity associated with type 1 diabetes. When it comes time to do clinical trials with next generation drugs, Mount Sinai is uniquely positioned to study patients of every age, both genders, every ethnicity, in enormous numbers. Mount Sinai is responsible for the care of something like 40% of all of the people in New York City. And so that means that we have access to huge numbers of people with diabetes. We also have strong support from the community and from the hospital to do just that.
Mount Sinai will play a critical role in improving diabetes care throughout our health system. We're already beginning to do that by identifying the highest risk patients with the worst diabetes care, having an intensive team approach where we're able to lower their hemoglobin A1Cs, and then refer in for the most intensive care the patients who are the most resistant to treatment. So we're really delivering the appropriate care in the appropriate location and referring people who need the most sophisticated management for type 2 diabetes.